When most people hear physical therapy, this is what they picture. A room full of treatment tables, a row of stationary bikes, maybe an older gentleman in the corner stretching his hamstrings. You have TheraBands and 3-pound dumbbells hanging from the wall. And that's because that's what physical therapy has looked like for decades. Today we know more about movement, mechanics, pain science, strength training, motor control, strength and conditioning, and all of these cutting edge things, and physical therapy still hasn't caught up. I think one of the hardest parts of me being a physical therapist is listening to other people's experience in physical therapy. It actually makes my heart sink when I hear what these people are doing in physical therapy. Most stories go like this. I walk in, I ride the bike for 10 minutes, or I walk on the treadmill for 10 minutes. They throw me on some heat. Maybe they have me do a few stretches. Then comes the time for me to strengthen. And when I strengthen, I usually do the bands, and I've gone up. They're praising I've gone up in the band color. Then I go on the table and the physical therapist massages my shoulder for 5 to 10 minutes, and then I'm out. And this is the exact process that most people go to, and what frustrates me to no end, because none of that tells me anyone has figured out the why they're in pain in the first place. So if they go in for their knee, they don't know why it's inflamed. Maybe they're going for their shoulder and can't figure out why it hurts in the first place. If your back goes out once every few months, well, why? That's the real question that physical therapy should be answering, not just slapping a bunch of Band-Aid treatments on top of it. For years, physical therapy followed a very simple model. If it's tight, stretch it, and if it's weak, strengthen it. They'd also say if it hurts, ice it, or massage it, or ultrasound it, or put heat on it. And here's the issue. Your body doesn't work in isolated pieces. It moves as an entire system. So for example, if your shoulder hurts, we need to understand what's happening at your rib cage. If your back hurts, we need to understand what's happening at your hip and your core, right? Like your back doesn't just magically start hurting because you have a bad back. Everything works together, and it can be explained identifying someone's movement compensations. So today, physical therapy should look so much different than it currently does in the mainstream world. Instead of asking where does it hurt, we're internally asking ourselves, why is that tissue, or why is that joint, or why is that part of the body taking on more stress than it's supposed to? How are you loading your body? Can your pelvis move independently of your spine? Can your rib cage rotate and turn? Are you leaning more towards one side or loading one side of your body more than the other? What does it look like when you walk? How about when you squat or when you lift objects up off the ground? What does your breathing pattern look like? Why are you compensating? Because if we can answer these questions, then we can solve the problem throughout your entire body. And if we can solve the movement problem in your entire body, then we can take the unnecessary stress off of that painful site and actually fix an issue at the core of it. Now that is a completely different philosophy, not one aimed at trying to cover up the pain, but actually restoring someone's entire movement. And that's exactly what we're about here at IDPT. People always come in and they say that this doesn't look like a physical therapy office at all. And that's the way that we designed it. Because we don't believe that physical therapy ends when you're out of pain. We believe that rehab ends when your body is fully functional and capable again. That's why you'll see squat racks, cable columns, medicine balls, kettlebells, leg press, hack squat machine, and so many more pieces of equipment. That's because strength matters. Power matters, coordination matters, and improving the way that your body moves is the ultimate thing that we focus on. If your goal is to return to lifting, well, we have to lift. If your goal is to get back to your sport, then we need to perform at the level of detail and intensity that your sport requires, not just lay on a table. On the flip side, people may come in and ask, so is this personal training? And it's not even close. Because strength, yes, it's a huge factor in what we do, but we need to get to the root cause and the why of why someone's body is loading ineffectively in the first place. That's where our ID realignment method comes into play. First, we're going to identify the root cause for you specifically, explain your diagnosis, and lay out a game plan of how we're going to treat that. Then we're going to use highly specialized hands-on treatment techniques, followed up with corrective exercises designed to treat the impairment that we found in your body. Then we're gonna move on to strength training, and then power, and eventually get you back to the sport or activity that you want to do. So overall, physical therapy has changed. And if you've been through physical therapy and it didn't work, don't assume that physical therapy doesn't work. Ask yourself a different question. Is what you went to today's physical therapy or the physical therapy of 20 years ago? Because those are two very different things. If you're curious what modern physical therapy looks like, come visit us. What you'll find is not a row of bikes or 10 treatment tables in an open room. Just one-on-one care focused on how your body moves so we can get you back to doing what you love. If this resonates with you, you can book a free discovery visit, which is a 30-minute consultation where we'll see how your body moves and give you your unique root cause diagnosis. So as always, guys, if you like this video, be sure to check out all of our other videos where we give modern solutions to all different diagnoses. Be sure to like, share, subscribe, and I'll see you at the next one.